It's in 3 parts. We have the overall title of our presentation is Therapy Partners, Patients and Families Co-Designing and Co-Producing Care. Now, those words, co-designing and co-producing, are very, very easy to read out. They're very, very difficult to do. And I know that what's going on in Free London, RoyalFree London NHS Foundation Trust is quite simply revolutionary. So I'm looking forward to hearing that. Then we're going to have a little bit of discussion around that, presentation around that, and then we're going to have an interview with 2 of the patient therapy partners, and then we're going to have an interview with the Trust Director of Nursing. So rather than me bumble on, can we just get started, and we'll ask you to introduce yourselves and your presentation for Therapy Partners, please. Joe, whoever's going first.
Hi, thank you so much for that introduction. We're delighted to be here today, and thank you so much for inviting us to come and talk about some of the work that we've been doing over the last 2 years. It's been small, but it's growing, and it's having impact in our organisation. So we're delighted that we're here, and in the true spirit of Therapy Partners and how we try and work, we'll try and make the professional bit at the beginning very small, because actually we want the voice of the patient and our partners to come through much more than ours, because we've realised over the last couple of years how important that is, and how often we sometimes take over as professionals or experts when we realise that actually the people that we're working with are these patients who've become our colleagues, really, have the they're the ones who with the lived experience, they're the experts. So there's going to be a little bit from Laura and I, just a bit of background, and then we'll hand over to them. So thank you for having us. My name is Karen Turner. I'm a Senior Improvement Advisor at the RoyalFree, but I got started on this project 2 years ago when I was actually a physiotherapist. I've been a physiotherapist at the RoyalFree for 17 years, which is why my involvement started. Lauren, do you want to introduce yourself?
Sure. Thank you, Karen. Yes, we're very excited to be presenting to you today. My name is Lauren Murphy. I'm one of the clinical lead speech language therapists within the therapy teams at the RoyalFree, and I work in the area of health services for elderly people.
Great. Thanks, Lauren. So we just want to give you just a little bit of background, really, about how this whole project started. So just over 2 years ago, Lauren, myself, and a brilliant colleague, Joe Moore, who's also here on the call. Hi, Joe. We were attending some clinical leads sort of an away day, and we were thinking about how to make improvements. And we started a work stream thinking about really what matters to patients and how we can get the patient voice into some of our improvement work. And we thought, okay, it would be great to start a group. So 2 years ago, we thought that would be a really good idea. But at the time, there wasn't a group that met at the RoyalFree. There wasn't a patient group that we could access. So we decided to make our own. And we got advice from different areas. We spoke to volunteering and the patient experience leads. But we basically were just slightly making it up as we went along. And we put some posters up, and we recruited some patient partners to be involved with us. And that's how it started. So our first meeting was in October 2018, and there was about 5 or 6 of us sat around, a very cold room, I seem to remember, sat around a table, and we had an idea of what we would do. So we had an idea that our patient partners would partner with different projects, and that's what we thought would happen. The great news was we had really good support from our managers. So Tracy Van Wijk was one of our managers, and Laura Ledsford, and they were really supportive of this project. So they let us test it out. And our aim at the time was that for all therapy quality improvement projects to have some form of patient engagement, because we realised that we were doing quite a lot of improvement work, but we were doing what we thought mattered, and we were improving what we thought mattered. And what we realised is that actually we weren't including the patients as much as we could. So there were 14 therapy teams, and we thought, what a great aim to try and involve all of these teams and get them to meet with patients and learn about their experiences and get the patient voice into improvement work. So that's what we are doing. And at the beginning, we were meeting face to face. We were meeting every 6 to 8 weeks. We'd come into a room and we'd get biscuits and tea and sit round, and we would have a really great time all together. And we would be showing, we'd be talking about different improvement projects, and they'd be giving their feedback. But obviously, things rapidly changed early this year because of COVID. And I'm going to try and share I can't quite share my screen yet. 6 weeks, so about, I think it was Lauren actually who stopped me in the corridor when we were in May and said, Karen, we've got quite a few things happening in the department at the moment. I really think we should start up therapy partners again. And so I said, okay, that's a great idea. How are we going to do that? So we thought maybe we knew we'd need to do something virtually. So we just gave it a go. We contacted our therapy partner, said, would you like to join again? Are you still interested? Do you still want to be part? There's lots of change going on. And so we set up on Zoom, didn't we? And it was like, our first meeting was hilarious because it took quite a long time to all get on, and we were all learning, we were all new to it. But during COVID, we actually met every single week because there was so much going on, and we didn't just have therapies who were coming, therapists with their projects. We had people from all over the hospital. And so that is what we did. I'm just going to hand over to Lauren, who's going to explain about some of the projects therapy partners have been involved in.
Oh, thank you very much, Karen. That's great. And I understand you're having difficulty sharing your screen at the moment.
I am, yeah. I'm going to give it a go while you're talking. Yeah.
Okay. So for those who are listening, we do have kind of an outline of what we're talking about today, as well as a bit more detail. So we will be able to share that with you. But as Karen was saying, you know, this has been such an evolving work. And we met and first started, it was myself, Karen, and Joe, and kind of thought, okay, this is how it's going to go. We're going to branch out, do some different kind of almost have subgroups, and they work for specific teams. But all that changed. Nothing how we had initially envisioned it to be with how it actually, oh, thank you, Karen, how it actually has turned out to be. And I think, you know, it's been such a great experience in that it is an evolving thing. It was evolving from the beginning, and since COVID, it has continued to evolve. So here's a little bit more detail that talks about the background, our aim, our method, also our driver diagram, so you can have a look at that in a bit more detail. But I guess the crux is, you know, what are the types of things we've been involved in? Well, I can still remember, I think way back, one of our first sessions was great, and there's a photo here about one of our rehab assistants and, you know, learning how to teach competencies. And our therapy partners were acting as real patients, and that's a nice picture of Anthea. But, you know, we've been doing many different things. We've had feedback from therapy partners about A&E therapists at the front door. We've had our consultants from the frailty pathway and frailty unit. How do we best develop that pathway? From a speech therapy point of view, we've gotten great feedback on acknowledged risk feeding. We've kind of done some role play sessions. You said we did. We've done an exercise class that was really exciting on Zoom. We had everybody practicing doing their chair exercises, all of us on a screen, so that the therapist could say, okay, when I roll this out, this is how we're going to do it. And our therapy partners just provided amazing feedback. We've had also really, you know, different initiatives. We've had 3 of our therapy partners that have been trained to participate in staff interviews. So staff interviews for therapists, and they, you know, they've been fantastic. We also have our therapy partners that have joined different committees. What Matters to Patients now has a strong patient presence. We've also, you know, presented at board meetings so that the exec team gets a little bit of input about how we've been doing. Other things since COVID, I think that's been one of the most interesting, exciting kind of evolutions, is that we're now branching out. And I think as Karen said, we got to meet once a week, and things were happening so quickly. You know, our therapy partners were involved in such things as kind of rehab buddy apps, you know, end of life care, talking about bereavement. How could we change that? How, you know, what would family and patients want? You know, they've also had lots of other things in terms of kind of end of life care. So, you know, it's really exciting, the input that we've had. And I know as a therapist, and I've presented one of my projects, the feedback that we've had is really, really invaluable. And as I kind of look to our poster here, where we talk a bit about, you know, what have been the feedback, we very much have the belief that if a group is going to come present to the therapy partners team, we want them then to come back and say, you know, you said this feedback, and this is how we changed it. So we, you know, that comes part of it. Our groups come and present to us. We can do either role plays, we can read different things, you know, and then a few weeks to even 3 months later, they come back for some feedback so that we can share to the partners. Actually, this is the kind of impact that your feedback has made, and these made changes. And, you know, or if they want more feedback, which we've done that on an occasional case, a few different sessions. So what are our staff saying? Well, as you can see here, that we've gotten some positive things, such as we can go forward with confidence and work and know we can continue to evolve with therapy partners. This has been a very valuable experience, and I know it will result in a better service going forward. We will take feedback and findings from the planning and meetings to help and inform the wider facilitation of this program. So, you know, we're quite fortunate that we have many different teams that come, either therapists or, you know, teams from the other hospital. And it's really important to us and the therapy partners to get this feedback. It also works both ways. You know, when we set this up, we were originally meeting, I think, every 3 months. And then at COVID, we started to move on a weekly basis. And we said to our partners, you know, is this too much? And everyone's feedback was no. It was the highlight of my week. We love getting your notes. Please, let's keep going. And that's been a real great initiative for us. So some of, you know, the therapy partners, and you're going to be meeting Evelyn and Anthea, and they'll speak in their own words, but, you know, they enjoy a safe space that has been created. Everyone's able to express their views freely, and we are united with a shared goal for improving patient care. And I think, you know, it really stands still, as Karen says, we look at them as colleagues. It's the therapy partners that chair the meeting. We are there to kind of help support things. I think, you know, the fact that this is, you know, something they've taken ownership on, and we really work well together as a collaborative group, you know, it certainly is the highlight of my week and something I look forward to on my Fridays. So I'm going to turn it back over to Karen.
Thank you. And yeah, just to wrap up before you meet our therapy partners, just to say, yeah, just about some of the things that we've learned as we've been going. I don't think any of us thought, Joe, Lauren or I, thought that we'd be here where we are now 2 years later. And we've now got Ashley, who's joined us as another member of the team, who sadly can't be here today as well. But we have learned so much, and we have learned so much from our partners and by working with them as our colleagues. We have learned that you know, they are brilliant at providing, you know, authentic, honest feedback. No, like they will really say it as it is, and
they don't hold back.
No holding back,
No.
Which is brilliant. And they have different opinions. So the other thing, you know, they have different ideas and different opinions, and they are brilliant. And the thing that I've learned recently is it actually works better virtually. I think the meetings work really well virtually. And it works better if we give people, give them information before. They are so diligent. They will read anything we send them, and they will research it, and they will look into it if it's a new topic for them. We've learned that it's really important to get feedback from, as Laura was saying, from the people who've joined the group and presented, so that we can feed back, so that they're not just, they see what happens with the feedback they've given, but then we have a cycle of learning, and that is really good. And as Lauren said as well, that there's, I found myself in our first meeting, I think, on Zoom, chairing the meeting, and I stopped myself in my tracks and said, what am I doing? This is the whole point of this, is that you are leading. This is your meeting, and we're trying to rebalance this power situation, and I should not be leading this. And so now we have a revolving chair, so we don't need the meetings. We organise them because we've got connections in the hospital. We organise who visits, but we don't chair. So one of our therapy partners chairs. And I have to say, it is not tokenistic. You know, and the people who visit, who really are open-minded, want to learn, they're the best meetings. If you come for a tick box, you're not going to get that from our therapy partners, because they all have stuff to say. And so don't ever come if it's just a tick box exercise to get something that you've designed that you think matters, and you haven't involved patients. Then that doesn't always go down so well. And I have to say, it really has shaped our projects and initiatives going forwards. And people have, they really enjoy it. As Lauren said, it's the highlight of my week as well. I really enjoy it because I learn so much. So I think, yeah, it's not a perfect group. Obviously, our therapy partners are perfect. We are not representative of our population, and we've tried to make it more diverse, and it's not a perfect group, but it is a brilliant group, and we are learning, and we are on a journey with our hospital now, and I really feel that it's influenced more of what's going on in the wider hospital as well. Our small group of our brilliant partners. So probably less. We don't need to hear any more from us now. I'll hand back to you. But that's the background of the project that we've been involved in. And a big thanks to Jo Moore, and a big thanks to Ashley as well, who've been making this possible. So thanks, everybody.
Thank you both very much indeed. That was an immensely helpful presentation. And I just want to say something as well. We are going to talk to the therapy partners just now. Is Evelyn joining us, by the way? Is she here? Can't see her.
Yeah, I can see her. I can see her.
Okay, yeah. Okay. I just want to say something to you guys. I mean, you're showing real leadership here. I mean, leadership sometimes is about letting go of power, you know, and handing it over to other people. And I think that you should be, the three of you should be immensely proud of what you've done. That's what I mean about the radical nature of this. This is not normal in the NHS in my experience. So I think that you should be really proud of what you've done. It's fantastic. Yeah. So Rachel and I are going to talk to Evelyn and Anthea just now. Rachel, it would be good for you to start off with Roy Lilly's quote about starting with the patient.
Yeah, so Roy Lilly's got a great quote, which is start with the patient and work backwards. And everything that you've discussed, your whole innovation at the Royal Free Hospital is starting with the patient and working backwards. And I think it's great to hear that you started it in 2018. What I found even more kind of powerful is that you've continued that throughout COVID. You've continued that co-production, that patient involvement. So yeah, it'd be great to hear now from the therapy partners. So I've just got a quick question for you both. Could you introduce yourself and tell us a little bit about what drew you to therapy partners?
Anthea, we'll go with you first.
Okay, so when I first left school, I started, but regrettably, did not complete nurse training. But nevertheless, over the years, I became acutely aware of how dedicated and committed health professionals are, but also how taxing and stressful their jobs can be, because 10 members of my immediate family are all in the medical professions, including my daughter, who's been at the Royal Free for 26 years, actually, and is one of the clinical leads in respiratory physio. And one of my sons, was a junior doctor there in the mid-90s. And for the last 30 years, before I retired, I designed and delivered personal effectiveness courses to a very wide variety of immensely diverse organizations, including the NHS, where I taught doctors how to read body language, and also, did some sessions before I read effectiveness courses to a very wide rapport with their patients. And then at the opposite end, I actually worked in 5-star hotels where the top priority for the staff there, body language, and nothing else mattered, was for them to understand what mattered most to their guest, so that the guests would leave with a positive and memorable experience of their stay. And in a very loosely based and way, I think that in many respects what mattered most to their equates to what I think patients would appreciate in a. Despite their enduring problems and reasons for being there, they would still like to have a positive feeling about the overall hospital experience. But it was when I was an inpatient around 8 years ago, when unfortunately I had a stroke, and then more latterly as an outpatient when I fractured my shoulder, that really got me thinking. And firstly, I thought how privileged and fortunate I was to be treated by such incredible, brilliant clinicians on our enviable NHS. It was just, there are no words to express how grateful I was for all that wonderful work. But then also how much better I thought that experience could have been if what mattered to me as the patient seemed to be given a little more attention. And often it was just the teeniest things, things that would cost nothing or very little that would have made all the difference. And just as, two seemingly trivial examples of that was when I was in the HASU, my treatment was nothing short of world, class, no questions about it. They left no stone unturned. It was just brilliant. But then when the night staff, every single night that I was in the hospital, just constantly shouted to each other over the wards, either asking questions or giving instructions, it really had a downward spiral on my well-being. I became, was sleep deprived. I became really exhausted. And being aphasic, I was just so agitated and frustrated. And so what really mattered to me there was that needing the peace and quiet at night, that would have really been very important to me, especially since the days were so busy and I was so frightened of my future, and, being speechless was not very pleasant. And then as a physiotherapy outpatient, my physiotherapist was absolutely brilliant. I absolutely loved her. She was great. But because I was in such agony, it was so excruciating that the exercises, by the time I got home, my concentration was so lacking that by the time I got home, I'd forgotten everything. And that really mattered to me because I wanted to do my exercises diligently to try and expedite my healing, but I was frightened because I didn't want to cause any further damage. So in that aspect, context, I would have loved just a little visual and just to give me some idea of, the confidence to go ahead and do what I wanted. As it so happens, that was 2 years ago, and the department had started developing something like that because therapy partners started soon after. In fact, it was my physio that told me about therapy partners and invited me to join. And so we've always, we also had a look at the leaflets that they had started developing. So what drew me to physio partner to therapy partners was the fact that I thought this is a great opportunity to meet like-minded people, to go into a group where we had a voice as patients, and that we could improve the learning experience between professionals and patients.
Fantastic.
Superb.
It's brilliant to hear how you used your own experience being a patient and how you want to now make things better for other patients and families. You know, and it's fantastic that the physiotherapist actually asked you to be involved in therapy partners. I think that's really good, because there are patients out there that really want to get involved in trust. They really want to help. They want to share their experience and make things better, but they don't know how to go about doing that. Fantastic. Thank you, Anthea. Evelyn, have you got, would you like to introduce yourself?
Yes. When I introduce myself, do you want me to say a bit like Anthea had just go on a bit about why I joined Therapy Partners?
Yeah, if you could introduce yourself, tell us a little bit about yourself, and then about what drew you to Therapy Partners. That'd be fantastic.
Okay. Well, I worked for Marie Curie Hospice Hampstead for 23 years in the patient and family support team in different roles, including clinical and managerial. Since retirement, which is now nearly 3 years ago, I've been working as a volunteer at the RoyalFree as a dementia companion and in the Macmillan Advice and Support Centre. Since lockdown in March, I've been involved in Check and Chat, which has been an initiative set up by the Social Hub to phone isolated and lonely outpatients. The volunteer department also asked me if I would ring up some of the more isolated elderly volunteers, which I've been doing. In addition to that, I've been doing with the through referral from the Occupational Health Department, I've been doing bereavement counselling with staff who would normally not necessarily work in ITU, but who have been working with COVID patients and who've had their own personal bereavements. From the point of view of why did I become part of Therapy Partners, that is obviously because I have been an inpatient and an outpatient at the RoyalFree, and the way I was asked to join was I was walking quite innocently down the main corridor of the RoyalFree when I was accosted by Karen, who said, "The very person." And I looked at Karen and I said, "What do you want?" And immediately she told me, and I thought, this sounds fantastic, this sounds stimulating, and said, "Yes, please," and haven't looked back since. So why did I want to join Therapy Partners? I suppose that throughout my career at Marie Curie and previously as a social worker in the community, I have always been very keen on enabling the patient, the client or the person I've been working with to reach their full potential. And I feel very much that, you know, patients, it's their body, their health, they should have more control over how it is managed. And I think, you know, you have shown very vividly this morning, Rachel, how the patient is often the expert. And I think, you know, I feel it is really, really important to change some of the balance of the power so that it's not doctor up in the heaven and patient right down below somewhere. Oh, I've gone. What's happened? I've disappeared.
Okay. You'll come back. Don't worry about it. There you are.
Okay. I'm back, but I can't see myself on the screen.
Don't worry.
We can see you now.
We can see you.
Can you see me?
Yes.
Okay.
Yes.
So, as I say, I think it's really important that you don't have the doctor up in the sky and the patient down below somewhere, that we start to try and change the culture of the NHS so that there is more balance and that we work more in partnership. And I feel very, very strongly and passionately about that and always have done. And I think that as Anthea said, that little things, the finer details are so important. I know that when I had my hip replacement a few years ago, that when I was discharged, I was given a whole lot of numbers, district nurse, occupational therapist, etc. And I was desperate to get hold of the district nurse to cancel an appointment because I had to go to my GP, and I kept on ringing and ringing, no response. Eventually, luckily, I was there when the district nurse came and said, "I've been trying to cancel you. I'm terribly sorry, you've made an unnecessary journey." And I told her the number. "Oh, that's the wrong number," she said, "that's outdated." And I had the same problem trying to get hold of other people in the community. So, you know, it's these things which, when you are feeling vulnerable at home, living on your own, you can get very anxious about. With perhaps normally you would just take it in your stride, but when you are more reliant on people, I think things like that. And on the ward, I've noticed it with, say, people, as Antje said, you know, if you've had a stroke and someone comes and plonks your tray on your bedside table, but you can't reach it, what's the point? You can't eat. Or if you're a dementia patient and your meal is left, but you don't realize that actually that's a meal you're meant to be eating. That, you know, it's the finer details. The professionals are there giving you fantastic care. And the care I had at the RoyalFree, when I had a hip done, when I had an oophorectomy over 30 years ago, is absolutely exemplary. That, you know, it's the finer details of daily living which change your quality of life so much. And that's what I think that, you know, as a therapy partner, I hope that we can start to change. And I think we are gradually doing it. It's chipping away. It's going to be slow. But I think, as Karen said, we can already see some change in the culture. And I must say, I have a lot of respect for professionals, because it must be very difficult for them to have us coming in and saying what we're saying and having a voice when they're not used to it. And I think, you know, as a patient, sometimes sitting on a committee, it's also, I find it quite difficult, because I think, what can I offer? They are the professionals. So it's a two-way thing, but I think we're getting there. That's basically me.
You've made some fantastic points, and you can really hear your passion, you know, and why you wanted to get involved in therapy partners, and some points that you made earlier about patients not able to reach food or to reach water. And yeah, fantastic. So my next question is for, I don't know who wants to go first, is what is the value of including the patient or carer when designing or improving healthcare services? Who wants to go first?
Well, I'll go after. We'd take it in turns, maybe.
Yes, I think we've had enough of my voice. But
you go. Well, it gives patients a voice. I think that is the main thing, and I feel passionately as well about giving patients a voice and the opportunity to express what matters to them, which is, you know, central to what good healthcare should be, really, what it should be about. And as Evelyn said, it's great for patients to take control and form better relationships with everyone involved in their care. You know, I also think that if the healthcare professionals had a greater understanding of what you know, the patients want and what matters to them, they are better placed to manage patients' expectations and to encourage them to be more self-involved, which I think, you know, it has a win-win effect ultimately, because then it might be able to lighten the load for the professionals. So I think it's really very vital that the patient has a voice. Yeah, I do.
Fantastic, thank you. I think you seem to cover it all. Evelyn, would you like to add anything?
Yes, I would. I will actually look perhaps a bit more on the admin side, which isn't my strong point. But I think one of the things that I think we have been doing is looking at leaflets together with the professionals. And I think one of the things is to ensure that they use everyday language. I think as professionals, and I know that I probably was a culprit at one point, we often use jargon and we don't always realize that we're doing so. It becomes such everyday language for us, but the leaflets need to be in everyday language. The design needs to be simple and easy to understand, because we've got to remember that as a patient, you're often, because you're very unwell, you can't concentrate well, you haven't got much concentration span, so you need something simple. And I think what we have found when we've been looking at leaflets together with the professionals, that although they've done some brilliant leaflets, sometimes they're too complicated, and as a patient you would give up looking at them because you would think, I don't understand this. So my message is short, concise, and simple for leaflets. And I think the other thing that, just to add to what Anthea is saying, as a patient, we are the experts. We know our bodies. That I think sometimes professionals forget that actually we know what's going on inside us. We may not always know exactly how we can be helped medically, but we know what's happening and where we need the help. And as an example, many, many years ago, they thought I might have a thyroid problem. So I was sent off to see the endocrinologist and the consultant. I walked into the room, and I'll never forget this. It's very many years ago. She looked down at the notes. She didn't look up at me once. She asked me why I was there. She made a few notes, and she said, "Oh, go and get a follow-up appointment." Not once did she look up at me the whole consultation. And when I came out, somebody said to me, "Well, you know, you'll never see her again. You'll now see the registrar next time." But that stayed with me, that actually she never looked at me. She never asked me how I was. I could have been Joe Bloggs for all she knew. And I think that has changed so much. I mean, I do think, and I also think that now the medical training, I've heard from one or two people, who do work who do train at medical school, that they are now looking much more at the psychological aspects of medical care as well. And I think that's so important, that the doctor has a good bedside manner, that he or she does look at where the patient is, and that they start coming together more.
Yeah, and you've made a really good point about the doctor, not looking at you. And now, because you're part of Therapy Partners, you can feed that back. You could talk about that. You could share your experience to make it better. And in having that the Therapy Partners project means that you've got a voice to be able to do that. Some trusts have similar, some trusts don't. Yeah. I found that sometimes, like when there's patients in the room, there can be some resistance from staff, but afterwards, when they think, oh, there's not much patients can give, afterwards they're usually quite shocked about how good it was to have a patient in the room and to hear from them.
Yeah, I must say, I mean, I do think that the example I just gave is an extreme one, but I just wanted to give it. I mean, that is extreme. I don't think that happens very often, to be honest.
Well, I think it probably happens more than we would like it to happen. That's for sure. I mean, you're beaming with happiness and purpose with this, and you've talked a lot about the positives about what's happening. I'd just like to explore to you what you think the danger is in not involving patients' voices in healthcare changes. Anthea, do you want to start?
Yeah, I think the danger of not involving patients is it creates a real disconnect, because I think that when you feel that you're uninformed and you don't know what's going on, you feel very isolated, and then you kind of think, well, the only way that I'm going to get anywhere is if I rely entirely on the NHS to just do things to me. Yeah. And so I think it's really important that we are encouraged as patients to become engaged in the whole process of learning from each other and of saying what we think is important. As Evelyn says, we know our bodies, we know what matters to us, we know what it is that's going to press the button that might give us, the motivation to do a lot more for ourselves. And then, sort of being piggy in the middle of knowing so many healthcare professionals within my family, I know, well, that might lighten the load, wouldn't it? It could easily lighten the load if Absolutely. We were more engaged in our own healing process.
Absolutely.
So I think there's a danger of that if we're not, at least consulted and spoken to and given a voice. And I think that's what might happen. I feel passionate about that,
Yeah, very important.
I think it's a lot of missed opportunities. That's what I think.
Evelyn, what are your reflections on this?
Well, I think that it's so easy, as I said already earlier on, for professionals not to appreciate the finer details, because I think the finer details have can have such a big effect on one's quality of life. And, you know, I think one of the things that we mustn't forget is that sometimes just by changing something very slightly, somebody's quality of life can be so enhanced. And I think it's the patient who knows about those finer details, that the medical and the nursing staff have so many other bigger issues to deal with that sometimes it gets overlooked. I also think that, you know, it is really important, because if you actually allow patients more voice, I think that hopefully not all patients do always take responsibility for their own health. But I think that if you give them a bit more control and power, they would be more encouraged to actually take some more responsibility, which would be good all round and would, as Anthea said, lighten the load for the medical staff, but also avoid perhaps some unnecessary medical problems. So I do feel that, you know, it is very, very important to try and change this power. And I think from both points of view, I think from the patient's point of view and the doctor's point of view, I do realise that for all professionals, but I think particularly for medical staff, for very many years, and it is changing and one can see the changes, but for very, very many years, I think lots of patients saw the doctor as God. This has changed now with the internet, and sometimes I must admit, I think the internet can be dangerous because you can get too much information which perhaps you don't understand, and you can get very anxious and worried about unnecessary things. So again, I think everything is a balance, and I think you know, if we can get the balance right, we're there.
I was reading something yesterday about ethics and models of medicine, and it's not that long ago that the model of medicine was paternalistic medicine, what they call paternalism in ethics, which means that you know, basically people did things to you, and
that's right.
They did it with good motives. They did it because they wanted to make you better, but they didn't include you in the process. And now the model is veered more towards consent. Nothing about me without me is the term that I would use. So I think that you've both described that incredibly well. Those are the dangers of not including patients' voices. Let's get positive again and tell me, what are the things that you've enjoyed most about? Because people will be listening to this and they'll be thinking, yeah, I could get involved in something like this, but I don't want it to be heavy or a burden or whatever. So what are the joyful parts of being part of this therapy partners group? Anthea, you start us off.
Yeah. Well, it is the highlight of my week. It really is. And I have most enjoyed working with our inspirational group of leaders who are forever encouraging. I mean, Karen Turner's enthusiasm and vision to get this established was and still is totally infectious. I mean, we just call it the Karen effect, because she just comes on and it's a go, go, go. It's so inspiring, I can't tell you. And then everyone in the group is so interesting, and you know, and due to the ground rules that were laid down right at the beginning, you know, we all feel that it's a really safe environment, and we've gelled together. So it's been very stimulating. The conversations amongst the group has been stimulating. The creative thinking.
Give me an example of some of the ground rules that makes it safe for you, Anthea.
Well, first of all, to respect each other, to respect each other's, whatever it is, what we're saying, that everybody might have a different opinion, but that you still have to be very respectful. Respect is a major part in that whole group, which I really appreciate, because it just allows you to accept everybody for who they are and what they do and what they say, etc. So it's a really great feeling. You feel very relaxed, so that you're not nervous or anxious about, you know, what you might say will be, you know, judged. There's no judgment. It's really fabulous. And then, you know, the fact that our projects are being looked at and acted upon really makes us feel very useful as a group. And just for an example, you know, one of the projects that we were involved in was the bereavement services project. I don't know if it's okay for me to mention something specific. Is that okay?
Yeah, sure.
And when the group's recommendations and ideas were followed through really in a very short space of time, the offices were moved from this really dark, dank, bowels of the earth office to the ground floor, right at the front of the hospital, where it's very light and easy for everybody to see. And then we agreed on a lovely logo and a sign, and it gives us such pleasure and pride to see this right in the entrance of the hospital, and to know that we've contributed to something so important and meaningful to people in their darkest hour. So, you know, that's really great. So there's so much positivity within the group that I just enjoy every single minute of it. I
get the impression that none of you are into talking shops, that you're doers. You want to see things happening, and I think you are seeing things happening, and the trust will be seeing that things are happening as well. Evelyn, what are the highlights for you in Therapy Partners?
Well, some of the highlights are what Auntie has said. I mean, the stimulation of the group is every time we have a group, I feel so stimulated. And I really look forward to our fortnightly meeting. I think what I have really enjoyed is the group of people who we all come from different walks of life. So we all have such a different experience to bring to the group. And I have learned so much from the other group members, and you know, from the therapy partners, from the therapists, from the therapy partner patients, from the people who come to present. And I hope in some little way I have been able to give back something to those in the group. So for me, I think it feels, and again, I will only reiterate the Karen Turner effect, the enthusiasm of Karen, who I have worked with for many, many years, and she has always been enthusiastic. It has never waned, is so contagious. And I think that she is the one who has managed to get the group to gel, that we can at times actually have fun. We can laugh sometimes when we're doing things, you know, we're doing serious stuff, that we can have a good laugh. And I think for me, humor goes an awful long way when one is doing things. So I think that is part of it. And there is something about this group that we do respect each other. We do allow everybody to have a voice. And even sometimes if you might bite your tongue and say, do you have to go on for so long rambling away? You don't say anything. Oh, I don't say anything. Other people may not think what I'm thinking, but I do know sometimes that I do think, do stop it now, but I wouldn't say anything.
I'll remember that, Evelyn. I'll remember that.
That's fantastic.
People say the same about me. So, and I think the other thing to say is, which is so important, and I think that will come in one of the other questions you asked, is that you do when you start a group, it doesn't just gel. You have to work at it. Yeah, and I think there's another question you're going to ask us later, Brian, where I will say what I think, how you can work out to get that to gel.
Well, yeah, you're reading my mind. Rachel and the Fab Academy are recording these sessions, so we've got the audience here, but we will have a wider audience, and these will be replayed throughout the year. Is that right, Rachel? They'll be
throughout the next weeks and months, the video will be replayed, and lots of people will get a chance to see it. I just want to, we've got about 12 minutes left until Rebecca, so I'll just let everybody know.
Yeah, okay. So just on the point then of the fact that people will be seeing and hearing what you're saying, and they'll be saying, how do I do that in my trust or in my hospital? What advice would you give them, Anthea?
So, I think first of all, are the changes that you're going to bring about? Do you want me to do that as well, and then whatever? Yeah. So the changes I would bring about for the startup group is, from the word go, I would really try to create a more diverse representative group in terms of age and gender, ethnicity, religion, LGBT. You just need to be proactive in enlisting those people. You know, I know it's hard. I think that's one thing that's a little lacking in our group at the moment, but I know we're working at it all the time. And I think a number of ways of achieving and getting a group together like this is, first of all, if you can ask people face to face, there are the odd occasions when you might still be able to do that. That's great. And then to call, and then if not that, to specifically call people that you've targeted, because you do feel, you know, quite flattered if somebody has singled you out to be a possibility to take part in a group like this. I think that could be a great way. And then when you're discharging patients, you know, you could add an extra question onto the questionnaire saying, would you be interested in being a patient representative, where you can express what your feelings are about patient care. And I think as well, what could be good is, especially when people are in the minority groups, to offer to buddy them so that they don't feel initially that, oh no, I don't know anything about this. It's, you know, you feel nervous about joining a group and they've never joined a group like this. So maybe for some of the professionals to offer a sort of a buddying system. And you can invite people on social media. I'm not on social media, but a lot of people are on social media. I think that's one way you can get a group like that going as well. And then project leaders around the organization can be in touch with each other in helping each other recruit for their groups, for their committees, their groups that they're running. So there are a number of ways, but I think it needs to be from the get-go that you try and get a diverse group together, because I think it becomes more difficult, you know, if you let it go.
Yeah. Evelyn, anything to add to that?
No, I mean, I think what Antje is saying is right, and I think we are all very aware in the group of the need to try and capture more diverse group of people. I think another way of doing it might be to ask randomly a few patients, would they be interested as a patient representative, and try to reassure them that it doesn't matter if they don't have any, if they feel they haven't got the right experience, they have, because they're patient. So that is the experience. And the other thing is, I wonder if one could just have a very short form which you could give to people, outpatients, if they're sitting in the clinic waiting to be seen, or if you could give it to people, to families and patients on the ward, so they could think, oh yes, perhaps when I go home I would be interested. So I think that's another way of doing it. I think in order, when you're planning a group, we've talked about respect, we've talked about ground rules, we've talked about allowing a voice. I think it would also help at the beginning if you did some team building exercises, just to make people feel more relaxed and to get to know each other a bit more before you actually start the real work. Just a few thoughts.
Can I add one more thing? I thought that what could be useful as well is to offer some technical support, either a little lesson on how to use technical support in terms of how to use the Zoom beforehand for people like Evelyn and I, maybe, dare I say, but also for people who may not have an iPhone or an iPad, and maybe to have a kind of a system where you could do a loan system so that nothing stops somebody from a different background joining. So just, you know, to add that in case that's one of the things that might hold people back from joining. I thought that could just be added in.
That's a very good point, Angie. And I had forgotten that, of course, now everything is virtual. And I think it is very important, particularly if we want to get more diverse group.
Yeah.
Then we do need to look at that, because, I mean, I think we do know that there is probably one person who started off in the group who isn't coming anymore because they don't have any technology and they are scared of it. So I think that is a very important point.
Yeah. That's a brilliant point, and actually follows on really good to one of our attendees' questions by Carl. How has it been doing the partnership via Zoom versus face-to-face? And have you had support to be able to do this, or anything that has made it work?
Well, we've had after you, Anthea.
No, go on. I was just going to say, we've had incredible support. I mean, Karen and the group of leaders have left no stone unturned in terms of keeping us happy and addressing any issues that we've come up with. Because we just say what we think. I mean, you know, we are quite a scary group, I think, actually. So we have been given support.
I mean, that's what's so lovely about our group. I think that because we feel safe, we do speak honestly and openly, and we can sometimes be quite difficult, I think, quite challenging. But with the support, I think I know I have at times been in a panic because I can't get in, or I can't see, or I can't hear. And Karen has always ring her, and she'll always very calmly talk you through it, because although generally I'm a calm person, when it comes to technology, I panic. So one time I panicked.
Yeah, well, last night we had a rehearsal getting through to this, and Rachel is the calm one and the IT one, and I'm the panicky one last night. Rachel, you want to? I believe that Rebecca's in the room now, so we've got
a little bit of time before. There's a couple of minutes before. We've got one more question for Anthea and Evelyn. What are the most important behaviours and attitudes needed from both therapy partners and clinicians to help make co-design, co-production sessions successful?
Well, shall I just go and just say, I think enthusiasm is the key to keep it going, for sure. And having someone at the helm that really believes in the value of patient partners, obviously, to keep it going. I've got here as well, the technical support, and keep it interesting by having a variety of things. And as Karen said at the beginning, we loved getting all those, the information beforehand so we could give it some thought. So it made it very stimulating and interesting. And also, we could do a little bit of research ourselves, having the information beforehand. And then the different professionals that were presenting to us, that made it, again, interesting. And especially when we knew that they were going to come back and tell us of the changes that they were going to make. So we knew they were coming back, so that kept it going. And also, it's motivating for us to do that. And incorporating some fun, like they said at the beginning. I mean, we had great fun doing those exercises. Everybody was busy jumping and doing and whatever. So, having some fun as well. So it makes the whole thing stimulating. And I think the most important thing is to just stay with it, because it becomes more satisfying every single day, honestly. The more you do it, the more you realize how great it is, and you gel together. And I think that's the way to keep it going in these COVID times. And actually, I've loved doing it online, to be honest. It's been kind of easier in a way than getting to the meetings and, taking public, it's more timely as well. It's not so time consuming getting there and what have you. So it's been great. I think that's one of the ways, is just staying with it.
Fantastic. Evelyn, have you got anything else to add to that question?
Yes, I mean, I think one of the things is that the variety of things that we discuss is what keeps you going, because every week it's something different. So it's another stimulation. And the fact that we know afterwards what the results. I also think that what is so important is that we are able to that everybody's able to take constructive criticism. That, I think that is so important, because in order to improve things, you need to be able to say, hey, that's not a good way to do it, but let's do it this way. And I think to respect that is really, really important. But for me, this is really one of the most stimulating things that I'm doing at the moment. And I really look forward every couple of weeks, not just to the stimulation, but to the camaraderie of the group. And would like to thank the therapists for all the hard work that they put in to organize. Very many thanks to Karen, Ashley, Lauren and Joe. Very, very many thanks for making it what it is.
Well, thank you very much for taking the time out today to come and speak to us. It's fantastic, the innovation and the work you're doing, and it's so good that you're flying the flag for patients and you're helping future patients and carers to come. So thank you so much for coming here. Like Brian said, it will be shared throughout the next weeks, months, so more people will get to see about the awesome work you've done. Brian, is there anything else you want to say before Rebecca comes on?
No, I wish you every best for the future. I think that you are really blazing a trail. Well done.
Can I just say one more thing? Thank you, Brian, and you and Rachel, so much for inviting us. I really feel it was a privilege to have the opportunity to be able to speak today. Thank you so much.
Yes,
and
likewise. Thank you. And you've put us at ease. And you put us at ease with your line of questioning. I was really nervous.
It's no need to be nervous. Rebecca Longmate, no need to be nervous either. Thank you for joining us. And my name is Brian Devlin, and I'll be giving you some quick, we'll have a discussion now for the next half hour or so. I know you're exceptionally busy, but we really appreciate it. Yeah, we can hear you and see you fine. Yeah, great.
Okay,
so, Rebecca, tell us a bit about yourself and about your role.
Okay, so my name is Rebecca Longmate. I'm the Director of Nursing at the RoyalFree Hospital in London, which is actually part of a group of hospitals. So I manage one particular site. I'm obviously professionally responsible for nursing staff and also therapy staff on site. I have the privilege of chairing the What Matters to You staff and patient committee. I manage the complaint process, and I'm also the lead on the site for quality improvement.
Well, that's a big job. Can you? I mean, we've heard. I don't know if you heard all of the presentation, but we've heard so much of really appealing stuff there from the patient therapy partners. Can you give us a few examples about how you've started to embed the patient's voice into what you're doing in the RoyalFree?
So we've always listened to the patient voice at the RoyalFree, but I don't think that we've ever made it as strong as it could be. So each year we have the What Matters to You, and we always celebrate that. We kind of balance it between patients and staff. And this time we concentrated on patients on I think the 9th of June. And we started conversations with patients, which were really important. Not the fact that that doesn't happen every day, but we wanted to really continue that theme, not just for one day, but to embrace the process and continue to do that. So what we've done is we've taken that process to some of the wards as part of QI projects. I always discuss it. It's a theme at the senior nurse meeting that meets every single week. So we have a theme every week, and What Matters to Patients is one of those themes. We have started looking at virtual visiting. So like everywhere, every hospital in COVID, there's relatives could not come into the hospital. So we had support through COVID, but of course, once that support left, we were faced with, well, how do we actually contact our patients? How do we keep our patients safe with being able to communicate with the outside world? So we started some communication around ensuring that all the multi-professional team can be involved in the process of contacting patients. So we started a very good QI project. The complaints have considerably reduced, where we've actually involved all the multi-professional team. What I mean by that is, if a patient has a specific issue around discharge, then it's probably better that a therapist rings the relative and lets them know about the processes that are going to happen at home. Or if it's a particular medical issue, then it's driven by medicine and nursing. So the onus is not on one particular professional group. And of course, my favourite is the What Matters to Patient Committee. So pre-COVID, we used to have patient committee every other month. During COVID, we stepped it up again because we had a few problems with the property of patients, which we knew was a problem. We started this virtual visiting, but now what we have a monthly What Matters to Patient committee, and we have 3 very vocal patients that sit on our committee. I must say it's my favourite committee of the month, and I'm really looking forward to it. And what that brings is a richness of conversation. They congratulate us when we've done things right, and they will challenge gently about, well, are you sure about that? Patients may want such and such, and so that's really actually gaining moss each month. We're getting better, and it just adds such a richness having patients there. my aim is to have more patients on that committee than we have staff.
That's really stimulating. That's really, really interesting. Now, before you came into the room, I don't know, maybe it was just when you came into the room, Evelyn and Anthea said, we're a scary committee. You know, we challenge. And my impression is that in modern leadership, that's not scary, actually. That's what we aim for. That's what we want to hear. Would you agree with that?
Absolutely. Yeah. Yes.
Yeah. It's got to be done with respect, and it's got to be done with kindness.
Yes, absolutely. And challenge shouldn't worry anybody. It just it's a different point of view. I see it as common sense. It's another view. So, you know, we have to accept that, and that's how we move on, and that's how we give patients better care at the end of the day, by being challenged.
You are the senior nurse in your area, and I'd like to just ask you what impact has involving patients had on you personally and professionally over the period of time that you've been in nursing?
So I think that the impact of patient stories and listening to patient is what we need to do more often. I think we do it, but I think that we need to do it more often. I think it provides that extra eye, that extra look of things, and I think care wouldn't be the care without that challenge on an everyday basis. And you know, it has worried me post-COVID of the lack of visitors into hospitals, because even though we can't do that and we're doing virtual visiting, they're the extra, you know, they're the extra pair of eyes. They pick up things that maybe other people don't. So it does worry me sometimes about that extra scrutiny that's there. Not the fact that my nurses do anything wrong, but it's just about that extra view and that extra lens. So I think
they know the patient in a different. They know the patient. They know the person who's a patient in a different setting.
Yes.
They have that intimacy of knowledge.
And I think sometimes we're frightened to ask the questions to patients because we don't know what the answer is going to be, and we might not be able to answer the question. And I encourage everybody to continue to ask those questions, and for us to be brave and to be prepared to be able to answer those questions psychologically as well. Very, very important. Very important.
And it's okay to say that you don't know the answer to some people's questions. So just play on that a little bit more then. What do you think are the real gains for staff and the patient experience when staff are listening to patients' stories, as you call them? I mean, I think that's a very good way of describing it. What do you think are the gains? Why is it important?
Well, the gains is the fact that you get to know the patient better than you did before, by talking to them, understanding what their needs are. By not listening to patients, you don't necessarily understand what they want, and that may delay things like discharge or further communication. So I think it's, you know, I think it's really important that we know what patients want. The other thing about that is I was recently involved in an incident where a patient told me that they overheard a particular nurse saying that which is not pleasant to hear, oh, the cardiac arrest in bed 22. Now that horrified me to hear that. But what I've done is I've shared that with nursing groups. Everybody was really upset about the fact that was said, and how we ensure that you know, that's not said again anywhere. But I think it's about listening to patients, understanding the complaints, and sharing those complaints with staff.
I think when I was working in the NHS up here in Scotland, I had the job of dealing with complaints, and one of the major causes of complaints, everybody says, is poor communication, isn't it? You know, if you get communication right, everything else falls in, if you can get the communication right. And I think listening to people's stories, because there has been a tendency in the past to say, well, people's stories are subjective. you know, that you can't apply them across the board, but actually there are themes that you can get out of people's stories, aren't there? There are recurring issues that, and so, for example, the cardiac in bed 7, immediately, as soon as you say that, you think, now that's been said before, you know, that is how it is, and challenging that is so important. Yeah. So, as I said, you are the senior leader in your trust in nursing. What do you think have been the barriers to embedding patients' voices into the culture of the organisation?
I think people are frightened to ask, as I said, I think I've said this earlier, I think some nurses and doctors may be frightened to ask certain questions because they're frightened that they may not be able to answer the question being asked. I think we have to be better and psychologically prepared to be prepared for those questions, because we only get the information if we ask the question. And if people are poor communicators, then we don't get the most out of the communication, the relationship with patient and a member of staff. I think sometimes it's a position of power and we don't particularly realise that. I don't think anybody intends to be more powerful than anybody else, but by lack of communication, by not communicating in the right way, that may feel like that. We've all been patients ourselves, as well as, so we've seen both things. We often hear that the patient care is excellent, however, I didn't get enough to drink, or something else happened. And it's the whole patient experience. It's not just that particular interaction. So when we talk about that, we just need to make sure that those barriers around communication. So we can't, you know, we need to communicate very clearly to everybody all the time. But sometimes we see that goes wrong, and that's why we get complaints. But sometimes it's over the simplest of things that you think, why did that happen? How did that happen? So it's about communication, and it's also about not blaming patients, and also not labelling patients either. So we need to be better at communicating with our patients all the time.
Well, tell me a little bit about how things are changing and preparing nurses and nurse training to engage more with the patient's voice. Is that changing at an educational level?
I think I'm not sure about in universities, but certainly on the wards, we encourage you know, student nurses to be involved in communicating widely with patients all the time. So we encourage that communication, and we have very clear, you know, standards at the RoyalFree, where we make sure that one of our statements is the fact that we need to clearly communicate with patients. So we try and emphasise that on recruitment, not just of student nurses, but of course of everybody in the organisation.
How does the board, the trust board, actually feel about this whole agenda of listening to patients? Is it something that's tokenistic, or is it actually taken on board as a
it's taken on board. At each board meeting, they listen to a patient story and a compliment. They're very much focused on the patient stories. I think we can do better around how the medium, which I'll talk about at the end, about next you know, the next exciting things that we perhaps want to do. But yes, it is taken as high priority at the board, and at all this. So the trust board of the group and on each side, that is taken very highly, taken very greatly, and we do listen to patient stories.
How do you get the patient? I'm very interested in this. How do you get these patient stories?
So we get them from complaints. So what we do is we read out a complaint that a patient has, their view of things, and then how we respond to that, and then we balance that with a compliment of a different area.
That's very interesting. So yeah, what is next for the RoyalFree? What's down the line that you can share with us?
So I think what I've learned is, so through COVID, we actually managed to get a patient that I put on loudspeaker in a senior nurse meeting, and he described his experience. He was very grateful of his experience at the RoyalFree, but there were certain things that didn't go so well. He was coughing, so the ITU experiences in ITU, went to the ward, and then he had a bit of a problem on the ward with coughing all the time, and nobody seemed to want to give him any tissues. And just simple things like that he thought could have been improved on. So I shared that story, and people were, the nurses listened. It was about, well, why did that happen? What can I do about that? So talking to people, talking to some of the patients in the committee, what we've decided to do, as you mentioned earlier, is perhaps theme some of the themes that are coming through the complaints. So one thing that we're going to pilot in the next couple of weeks, because I've got a patient that's willing to be my guinea pig on this, is, for me, one of the things that comes up is about pain and pain management. Okay. So what we're going to try and do is, I've spoken to a patient actually about pain. She's a lady that's got chronic pain, and some of the things that have happened to her in hospital. So what we're going to try and do is do a video on Teams where we're going to ask a series of questions, so that then I can showcase that video to a larger audience, whether that be nurses, doctors, allied professionals. So I think that seeing a patient and protecting that patient, so not necessarily in the room, because some patients would feel quite intimidated by that, I think that may be a better way to talk about a particular issue, rather than just reading out a complaint or I think that's more powerful, and that will generate discussion and debate, and that will hopefully improve care. I'm hoping. So just a different way of doing things, because I think that we've all gone onto Teams a lot more now, and I think there are disadvantages of Teams meetings like Zoom and Teams, but there are also great advantages of doing something like this, and also recording those experiences. So I just want to try and embrace that. And we plan, as you said, communication is often a key theme. So we're looking at themes within communication that happen a lot within our hospitals, that we could perhaps record and get patient stories to tell that.
Can you give me some examples of what? Can you give me some broad examples of what the themes might be?
So we're going to look at pain to start off with, and then there's a lot about appointments, the appointments into the system. There's also around communication and how people talk to people on the wards, and how they come across, and what that means to the patient, but also what that means to the member of staff. So pain is the only one we've actually perhaps sealed at the moment, but we're going through the rest of the complaints just to see whether there's any particular themes that we'll work on. So the aim is probably to get 4 different patients talking about 4 different things to start off with, and then we'll see how that goes.
That's amazing. Really, really interesting stuff. Rachel, are there any points being raised by the group?
Yes, Brian, I was just about to butt in and ask. So we've had a good question by, let me just find it, by Carol, who is an active patient leader, and she's very passionate about what she does. And her question is, do you involve patients and carers in day-to-day decisions?
Well, I think that patients and carers are involved in the discharge process and in multi-professional teams when there's difficult conversations. So I think from a multi-professional point of view, family and carers are involved in that in relation to discharge and maybe difficult decisions to make about care. So I think that happens, but I don't think it happens on every particular situation. But I think it does happen in certain cases, but not on every conversation. No.
Yeah, Carol just also put wider issues. So I think, which I suppose the Therapy Partners group does discuss some QI improvements. And I suppose co-production is being done in that way.
Yes, Yes, absolutely. And we also have something called the clinical practice groups. So we've set something up, CPGs, and we're looking at changing pathways across the group. And patients have been heavily involved in actually mapping those pathways out. And we've had some great successes with looking after children with asthma, and how we've changed that process by talking to parents and children about the treatment that they get. And then chronic diseases, we've heavily involved IBD patients in the review of the gastroenterology pathway. So we have actively done that, and we've actually involved, quite a few of our staff have been trained with the point of care training as well, through the CPG pathway. So we are doing other things other than therapy partners, but it's something that we need to pull together, I think, across the sites into one larger group to make the most of patients' time and the effective management on changing those pathways.
Yeah, and you're starting to do that, and that's what Anthea and Evelyn were talking about, how it's the start of it, and expanding on that. I really like that the What Matters to You committee actually has patients in that. I really like that you've got, and I really like what you said, that you want to have more patients than staff. And I'm a big fan of What Matters to You campaign. I'm a big fan of that. And what matters to one patient is different to another. And if the staff look at it for what matters to them, they're quite shocked when actually patients go, I don't mind anything else. I just want to have water on my bed, or I just want to be able to sleep at night.
Yes.
It's quite yeah, brilliant. And then we've got a couple of minutes. We've got 10 minutes left. I know I had a question. I'll just quickly
please carry on.
So has there been any resistance from staff getting patients in the room with therapy partners or the What Matters to You committee?
No, not at all.
Really?
Actually.
That's surprising.
No.
That's good, because in my trust it has been.
I think there's one committee that we don't have a patient, and I think there has been some resistance, is in our patient safety committee, of which I think I need to go back to that and relook at that. So we have started by having purely patient committees, what Karen's doing with patient therapies, and I think that the patient experience committee is the only other committee that's got 3 patients in. Then there is the clinical pathway CPGs, and patients are brought in to discuss the pathways across. So even though we've started this and we've moved on, we're not there yet. So and we do a lot of patient interaction with cancer as well. They've got a separate cancer patient experience. We've got a renal kind of patient committee. So we've got pockets. So I think one of when I was asked around what next, yes, I want to create these stories, because I really want to make sure that we see, we hear, we care, and I want that to come across. But I think what we also need to do is pull together what we're doing to maximise that patient involvement, and I suppose that's also the next thing to do, because we've got pockets, and the only place I think that's really come together is the patient, which should be expected, is the patient experience committee. But I think we could do more around that, and we need to continue that journey. And I think we've really made a good start to that journey, but I think there's lots more we can do.
Jo, did you want to say something, Jo? Did you have your hand up, or did Jo? No. Evelyn, is there anything that you want to say from what you've heard?
No, I mean, I think Rebecca's way of doing things, Outlook, is actually fantastic, and I must say that being on the What Matters patients experience, that she is so encouraging. Rebecca always may ensure that patients are brought in, and I mean, it would be so easy for the chair just to do lip service to the patients, but Rebecca always ensures that we have a voice and that we say something, and encourages us to do so. And I mean, I've just been so stimulated by her talk this afternoon. I think it's really fantastic.
Thank you.
I think a lot of people will. I think a lot of people will be, and perhaps that's where we go next with this. Is, I mean, I detect now that there is a movement around greater and more true and authentic patient involvement in the design and implementation of health services. What would be your message to government in this area? What would you like to say about the role of patient involvement to the politicians?
I think it's something that we need to do every single day, and I think we do that, but I think it needs to be more obvious. And I think that certainly what I've learned myself through COVID, and it's not. I know this conference is about patients, but equally this is also about our staff as well. And I think there is something about, as I mentioned, I see, I hear, I care of both staff and patients. And I think as leaders, we have to be humble. And I think that we have to inquire into things that may be difficult, maybe too difficult for some staff to talk about, but I think that, and patients to talk about, but I think we need to ask those difficult questions. And I think sometimes when it gets difficult, we stop. And I think that's no criticism about anybody or anything, but I think we just need to keep going. I think we've recognised over the years the power of the patient voice. I just think we just need to continue on that journey and find every possible avenue to be able to do that.
Yeah, excellent. And really my last question, and Rachel, come in if there's any more, is has COVID been, I mean, it's been horrible, and it's still with us, and it will be with us for a long time. But in this particular area of patient involvement, Rachel and I were having a discussion earlier on today, and in your area, Rachel, COVID, in a sense, has been a cover to just stop this co-production stuff and to pull a plug on it in some ways, we suspect. But that's not happening in the Royal Free. You're managing to work through this. So how are you? What's your message to the rest of the NHS about how you do this?
I think it's come out of. I think a lot of this is, for me personally, is about the fact that we stopped visiting. We stopped patients being able to talk to their relatives, and they couldn't come into hospital. I mean, I'm just experiencing somebody, a friend of mine has gone into hospital, and we had to drop her at the door, and then we've had to FaceTime. And I think, so that's highlighted that patients get, I deal with a lot of complaints and issues about the fact of why relatives can't come in, and the fact that nobody's communicating with them. So I think that a lot of the work that I've been very interested in and wanted to progress is how we make communication better. Yeah. And this, we found ourselves into this very difficult situation. What we've now done is we've written a compassionate visiting policy, because we've got to balance the needs of the patients and the infection. And we've got to, we've got some patients that have been in hospital for such a long time, and we've had to balance relatives coming into that. So I think that the reason personally I've been involved in this is because that in some cases has really upset me, about people not being able to see their loved ones in hospital, and so important that we continue to communicate perhaps in different ways and learn in different ways. So that personally for me has been a heartache, I would say.
Rebecca, we're running out of time, but you used the word humility there in terms of leadership, and I think that's been a theme of this whole session today from your trust. I think that humble leadership, I think, is so important, because it pays off tremendously. I'd like to thank you very much indeed for coming along. I know how busy you all are. You're all very important people, and I know that this will be listened to again and again by other audiences. So thank you, Rebecca. Thank you all very much indeed for this session.
Thank you.
Thank you. Well done.
Thank you very much.
Thank you.